What's up, class? My name is Lawrence Ojo,
I'm Carlos Lomeli.
And I'm Katie Guardado.
and our report is on clinician support after adverse events. And so our event, we looked at a study that was completed at Barnes Jewish Hospital in St. Louis, Missouri. Barnes Jewish Hospital is a pediatric hospital that has 280 beds and over 2,400 physicians on staff. The hospital is utilized by Washington University School of Medicine as a primary teaching facility. They have 1,350 of the 2,400 physicians on staff as members of the Washington University Physicians Faculty Practice Plan. In our event in April 2014, the university created a peer support program at the hospital. The ultimate goal of the program was to provide trusted and trained peers with support after an adverse event occurred. The program contains 3 training sessions that include research on physician resilience, methods of enhancing resilience, prospective peer support, coping mechanisms, warning signs for depression and suicide, and additional support. Risk involved with the event. Physically, participation in the program may cause physicians to feel burnt out and fatigued. The program would be taking time out of the physician's day and adding more to their busy schedules. Emotionally, the emotional distress that is felt by physicians after adverse events occur may affect their professional and personal lives. Physicians sharing their mistakes with their peers may cause them to feel guilt, shame, and anxiety. The emotional distress created may cause the physician to lose confidence in their work. Financially, the program relies on volunteer contributions from the participants. The study stated that it was difficult to sustain frequent participants to the program due to conflicting schedules and priorities. To fully utilize the program, resources must be allocated into the program to see benefits. Organizationally, the organization will have to create a culture of openness and honesty to allow the program to flourish. Physicians will have to be open to reporting on mistakes and errors to peers. Physicians are unable to properly report and communicate, the program will never work. My bad, I'll just cut all this out. So everyone's just acting up.
So highlighting some of the specific risks, the one we chose to highlight is mistakes that happen, during the operation. So while careless mistakes, also happen during operations, others can result from stress, exhaustion, other internal factors that physicians may or may not be speaking on. The one that we're specifically focusing on is burnout, which has drawn a lot of attention in healthcare organizations. That ultimately impacts the mental and physical health that physicians and clinicians have, and they have been associated with self-reported medical errors among them. Burnout symptoms commonly include emotional exhaustion, impact, or personal accomplishment, and depersonalization, kind of feeling like they're not accomplishing much. And next, we'll go on to the NPSGs that we focus specifically on this paper. So the 3 that we chose were preventing mistakes during surgery, preventing patient infection, and improving overall staff communication. And here we have listed the ways in which these NPSGs can be met. So while preventing mistakes during surgery, it's important to make sure that the correct surgery is done on the correct patient and in the correct body part, marking the correct place on the patient's body. And right before surgery is to take place, make sure you pause to make sure that no mistake is happening. Preventing patient infection, healthcare organizations can use the cleaning guidelines from the Centers for Disease Control and Prevention, or the World Health Organization. And improving staff communications. Ultimately, it's important to get the test results to the right staff person on time, rather than potentially getting the results to staff members that are not appointed certain tests.
Okay, so I'll be talking about the actions that are to be taken according to the risks. So the first one we had talked about was, making mistakes during surgery, and a way to fix that was to, take a pause and really understand everything that's happening, making sure that the patient is the correct patient, they're getting the right procedure done, or you have the right information. And then the second one, preventing patient infection. And what you want to do is reduce the mental and emotional burnout within the staff, and we talked about that a little bit already. The reason that sometimes infection happens is because people aren't being as cautious as they usually are. They just want to like get their day done with. And then the third action that could be taken is creating a culture of openness with the entire staff. And this one connects with the focus on improving staff communication. Because, you know, in that sort of setting, you do need to be on the same page, having the same reason. Like you're just doing this for the good of the patients. And to conclude our presentation, we learned that there are many national patient safety goals to just keep the hospitals safe or other healthcare organizations. And the three that are most important in a hospital are the prevention of mistakes, prevention of infection, and the improvement of staff communication. And as we had talked about, burnout is a big problem in the healthcare world, but there are some solutions out there already. A lot of it deals with staffing and just, you know, the schedules people take, having their proper breaks. And to end it, I just wanted to talk about how, you know, the fatality of a patient is no joke, because you really need to be understanding, like, you have someone's life at stake, their family is trusting you, they are trusting you. So you need to be aware of, you know, the risks that are there when you're doing a procedure or a surgery, and you need to be educated on how to prevent those mistakes. And that's all.